NHS nurses from overseas are being pushed into poverty because of rules that deprive many people coming to work in the UK of welfare benefits for 5 years after they arrive. They are being forced to borrow money, run up credit card debts, and go without food because they are unable to make ends meet, according to a report from the Royal College of Nursing. The nurses are on temporary visas, which means they are subject to the no recourse to public funds rule that bars them from claiming child benefit, housing benefit, and universal credit for at least 5 years before they can apply for indefinite leave to remain. The RCN is urging ministers to scrap the rule, which it says is unfair because foreign trained nurses cannot obtain the benefits despite paying income tax and national insurance. The report, based on a survey of more than 3,000 foreign nurses, warns that the policy punishes people for coming to the UK to work in the UK, is risking a mass exodus of international nursing staff. The understaffed health services already has about 40,000 vacancies for nurses. One nurse said, "I have to borrow money from people. I have to go without food at times. I have to rely on my abusive ex-partner." Another said, "I had to go into credit card debt and do more weekend and night shifts in the past. This meant that I was away from my child and relied on the help of friends for childcare on nights and at weekends." A third said that the inability to access benefits discriminated against immigrants because it is another way of saying we care less about your welfare but are interested more about what you have to offer our society. Last Friday, the United Nations said that it too wanted the rule asked for migrants. In a report about people of color in the UK, its commitment on the elimination of racial discrimination recommended that the state party UK government reverse the no recourse to public funds rule and ensure that it does not expose migrant households to a higher risk of poverty and precarity. Patricia McNeil, the RNC Executive Director for England, said, "As it stands, the current system denies migrants access to vital benefits despite paying tax and doing the same work as their domestic trained colleagues. The reality is that migrant nursing staffs pushed into poverty will simply choose somewhere else to do their nursing. This is a tragedy for patient care." Yes, so you see, when the people that are not trained nurses that are hoping to come to UK will be reading news like this or watching videos like this, they will have no choice than to go to countries whereby they can pay tax, have insurance, and at least be able to claim some benefits if their basic salary at the moment won't be able to accommodate that. Yes, because these people are coming to the UK, they are bringing in their expertise, they are paying tax in this country, and they are contributing to this society. So I think the UK as a country have to review this law and think about how they are going to do it to make it better, because as you can see, the UK health sector need a whole lot of trained nurses coming from overseas until they can train their own citizens to fill in those gaps. They still need foreign trained nurses to fill in those gaps at the moment.